The president of the Public Health Foundation of India said that leadership across the country did not adequately convey this was an epidemic where it had not gone away. Victory was declared prematurely, and that ebullient mood was communicated across the country, especially by politicians who wanted to get the economy going and wanted to get back to campaigning. And that gave the virus the chance to rise again. I feel like that's our entire experience in the latter half of 2020 here in the US. That's what they were doing there too. Now, let's get scary. At least 24 COVID-19 patients in Western India died on Wednesday when the oxygen supply to their ventilators ran out amid a nationwide shortage of the gas and a surge in infections. They're just running out of oxygen in hospitals. It's gotten so bad that some people tried to loot an oxygen tanker, forcing authorities to beef up security. Because after all, if you can take it, it's worth a lot of money in a country that desperately needs it and doesn't have it. In addition, gas and firewood furnaces at a crematorium in the Western Indian state of Gujarat have been running so long without a break during the pandemic that metal parts have begun to melt. And with hospitals full and oxygen and medicines in short supply in an already creaky health system, several big cities are reporting far larger numbers of cremations and burials under coronavirus protocols than the official death tolls, according to crematorium and cemetery workers. And we have one quote from one, Prashant Kabrawala, a manager at a crematorium, who said, "I have been regularly going to the crematorium since 1987 and been involved in its day-to-day functioning since 2005. But I haven't seen so many dead bodies coming for cremation in all these years, even during an outbreak of the bubonic plague in 1994 and floods in 2006. So all of this points to the numbers look really bad, but the numbers aren't actually reflective of how bad it is. And God only knows, maybe we'll never know. Maybe in 6 months, there'll be a study that shows that 5,000 people, 10,000 people were dying every day. I don't know, but I do know that if we don't help, it is likely to continue, and that is a tragedy that cannot be allowed.
Oh, absolutely not. And just hearing you read that quote kind of broke my heart, because in addition to all of the unnecessary deaths and suffering, just the emotional and mental weight and impact of dealing with this scope of crisis, where you're dealing with this level of death and despair every single day like we've never seen before. I mean, it just really, it's heartbreaking. And I think if reading quotes like that doesn't motivate people to say like, my God, we need to act, I don't know what will.
Exactly, you're 100% right. Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.